Robert here with MedPriva. It is 7 p.m., specifically 7:01 or 7:04 here in East Africa. Thank you for joining us. We have been teaching you about the preventable diseases, specifically preventive medicine here at MedPriva. And we start with the silent killer, hypertension, high blood pressure if you like, and we went through what it is, but we started with the complications so that if you, to help you understand exactly what it is that we are referring to. And also we, on purpose, we avoid medical jargon and medical terminologies to help you become an informed consumer of healthcare, so you can be able to ask questions, take care of yourself, and simply understand some of these processes that sometimes look like they are, they are written in Greek, but they're very simple things. And so today we will focus our description that keeps you from prescriptions, and if your prescription helps you again to be able to better take care of yourself. We'll be talking about diabetes, and we will start with the symptoms. So just like we did with high blood pressure, we will end with what it is, but we'll focus on the effects or the complications so that again you can take it seriously. And the reason as to why we do this is because these three diseases, for the most part, they don't have pain in the beginning. I mean, so you're not going to feel any pain, and it becomes challenging because most people are socialized to think if you're sick, you should be in pain. And for diabetes, the good thing is you have some symptoms that will be telling you that somebody has diabetes or their sugar is high, but it's not going to be painful. And obviously, complications of diabetes will, can possibly bring about things that are painful. But for now, we will focus on the symptoms. And the three major symptoms that, tell somebody or will show up when somebody has diabetes or high blood sugar, and their numbers, and we'll talk about that in a different episode, the last episode of diabetes. There are three major symptoms that will show up, and that will be polydipsia, polyphagia, polyuria. Sounds Greek. Poly just means many. So basically, it's somebody will be excessively thirsty. They will have, they will be eating quite a bit, very hungry, and they will also be urinating a lot. And today we'll focus on why those three things. So they are known, the three main symptoms of somebody having high sugar, high blood sugar, or diabetes. So we'll, find out exactly why they have these symptoms. So again, if something is described as high, that means there is normal and there is low. So when the sugar is high, it's above a certain number, and again we'll talk about that later. Remember when we check this sugar, we're checking blood sugar. So where is that sugar? It's the sugar in the blood. The sugar in the blood, there is no problem there if it is normal. But when it is high, and the reason as to why it's going to be high is because if you think of the pipes, the vascular system is a highway that takes that sugar from your stomach once you eat glucose and takes it to the cells where it's needed to give those cells energy. And again, we are simplistic for a reason. But for that sugar, for that glucose to leave the pipes, the vascular system, the highway, something has to tell that sugar to get out. It comes in from the stomach or the intestines passively, meaning, without effort. But for it to get out of the pipes, insulin, which is produced by by the pancreas, has to tell, basically, as an analogy or figure of speech, opens the door to the cell so that the sugar can get in. So when somebody has less insulin or inadequate insulin, the hormone that tells that sugar, and I want you to think of that insulin as a policeman, traffic police that tells the sugar, get off the highway and get into the cell. So when you don't have enough, whatever, we'll talk about reasons why somebody will not have enough in terms of what is called diabetes type 1 and type 2. When they don't have enough, or their cells, because they have adipose tissue or fatty tissue, or they have accumulated so much fat that the insulin, the polyps, has a hard time opening the door so that the sugar can get in, then that sugar is going to be hanging out in the pipes, in the vascular system. And that's where exactly now the problem starts, because you're going to have all these symptoms. And what are the symptoms? Remember, the symptoms is excessive thirst, drinking, so you'll end up drinking a lot of water, urinating a lot, polyuria, and you'll be feeling hungry a lot. So remember, this sugar is stuck in your vascular system, in the pipes. It's supposed to go to the cells. So what happens, that sugar creates what we call osmotic pressure, which means it pulls water from so remember, those pipes are going through your muscles, your tissue. Think of them like sponge, pipes going through sponge, and these sponges are full of water. So what the sugar will do or causes in your blood body is to have that water start moving. It's pulled by the sugar inside the pipes from your tissues or from the sponges. Think of muscles again as sponge. So it pulls it in and it starts accumulating in the pipes. But the kidneys think, oh, that's too much water. You're supposed to have about 5 liters as an adult of blood, mostly that is water. And as you start, the sugar will start pulling a lot of water from your muscles. And so the kidneys think, oh, blood pressure is rising, too much water in the vascular system. What do? We need to get rid of it. How do kidneys get rid of that water? You urinate it. So that's why the first sign is that when the sugar is high, you'll have this person. They'll be going to the bathroom to urinate a lot, because again, they are pulling water from their muscles, or the sugar that is stuck in their vascular system is pulling water from their tissue, from their cells, from their muscles, and into the vascular system. And the only way to make sure you don't have damages, the kidney will have to release that water through your urine, and this person will keep going to the bathroom. As this happens, the brain senses that your tissues, your muscles are losing so much water. So now the brain tells you you're thirsty, because there is water, but the water is in the wrong place and is getting out through urine. And so you drink a lot. So you're losing so much water through urination, your muscles are dehydrated, and now your brain is telling you you're thirsty. So you're drinking and peeing. But remember, the sugar is still stuck in the vascular system, because there is not enough insulin, or there is no insulin, depending on which diabetes we're talking about, there is not enough insulin to tell the sugar to get out into the cell where it's needed. And so now the brain, on top of telling you that you're thirsty, the cells are not getting glucose. And so the brain tells you, my friend, you are hungry. And guess what do? You actually crave something that has sugar. And now the problem was, you have too much sugar in the vascular system, blood sugar in the blood, and now your brain is telling you need to eat more, and your sugar will keep going up and up. And that's simply because, for whatever reason, again, the insulin that is produced by your pancreas that is supposed to tell the sugar to get out is not enough, or the cells where that sugar is supposed to go are resistant to that insulin, meaning the insulin has a hard time opening the door for the sugar to get into that cell. And so that's basically why you will have those 3 symptoms: polydipsia, polyuria, and polyphagia. So you're eating a lot, you're thirsty a lot, and you're urinating a lot as a result of what? Diabetes. Remember, this has no pain, and most people, if they're going to the bathroom quite a bit, they don't think of themselves as sick. They will actually think they're going to urinate quite a bit because they are drinking, but they are drinking because they're thirsty. They're thirsty because they're urinating. So it's almost like a vicious cycle. And they're also hungry. And remember, they have too much sugar, and then now eat sugar, and they're increasing. So the sad thing is that they go to the hospital, and this is where I was saying some of these things is actually very sad, because you will go to the hospital and they will tell you that you need to go to ICU because your body is severely dehydrated. And and you're thinking, I am okay, I don't have any pain. Again, we will talk about why, and actually I need to touch on it a little bit, why we end up having some of these diagnoses. If you're drinking sodas and juice and yogurts, things that you don't chew, the reason as to why we have teeth, it means anything that we ingest or we eat, for the most part, we should chew it. If you're not chewing it, it means you are taking more than you need. And if you think about it, how many oranges does it take to make one glass of orange juice or apple juice or whatever juice? Many oranges. If you are to actually have those fruits instead of juice, you might not even finish all of them. But when you take it as a juice, there is all this sugar that is there that is getting into your bloodstream at the same time and telling your pancreas to overwork to deal with all that sugar. But if you had taken it in orange or in fruit form, your body would have had time to actually process this sugar or without overworking the pancreas, which over time wears it out, where it stops producing enough insulin, and therefore you end up having this diagnosis called diabetes. So it's because we are taking things in excess, and there are so many reasons. Obviously we will focus on specifically on some of these things, so you can be a better informed person, informed healthcare consumer, and so you can be able to be changing some of these things. So we'll focus on that next time. How do we end up having sugar that is so high in our blood, and how do we overwork our pancreas, and what it is that you ought to do. So that's quite simple. Again, I keep saying, if you like what we're doing, please let us know, give us feedback. We do have a book. I've written a book available on Amazon.com called Dollar Altar, and I have a chapter interesting related to healthcare that is called Disease Capitalism in that book. So if you like it, let us know. My name is Robert. Nice talking to you. Have a good evening.